Hello, welcome back to another episode of Ingredients for a Better Life. I'm DNA Chef Jay, joined again weekly by Dr. Robert Nettles, Chief Medical Scientist and founder of the Stop and Regrow Hair Regrowth Program. Good morning, Doctor.
Good morning, Chef Jay. How are you, my friend?
Pretty well, very well, thank you. Um, so today, another trending topic on Google, how to identify male pattern baldness. People want to know, from trending, searching these Google, people want to know how to identify if I potentially have hair loss or male pattern baldness. And related to that, how much hair should I expect to see in a shower? What is normal for hair loss?
All right, very good questions. I've got a slide on the PowerPoint I might bring over that we can use to describe some. Why don't I do that right now, Chef
Is
Jay?
that is that the hair cycle that we're going to do?
I'm going to do something even better for you and your viewers and listeners, Chef Jay. Hopefully, the viewers will get to see this. Share my screen. Let me see what I can find. Let me see what I can find for Chef Jay's audience. All right, so patterns of hair loss. So if someone is typing into Google pattern of hair loss, that is a good sign, Chef Jay. That is a very good sign because without first identifying the pattern of hair loss, you cannot move forward. Okay, so
Yep.
what light allows us to see is a pattern of hair loss. So someone typed into Google pattern of hair loss. That's great. All the other words were mistakes. Okay, male, female, male, all that pattern of hair loss. First, identify the patterns of hair loss. And the first thing the person that types in needs to identify is the timing of the pattern, Chef Jay. Is this an acute pattern? What does that mean, Doctor? Acute. I'm not cute. Well, it's not cute. It means something that happens pretty quickly. So what can
Yep.
happen? Well, how quickly, Doc? 1 day, 2 days? Less than 4 weeks, okay? And Chef Jay, that will be less than 1% of the Google searchers. Less than
Yep.
1%. So I wouldn't type that one, but they could. If they typed acute patterns, what can happen in a very short time? Well, stress. Stress can cause hair loss. And the good thing is, God will heal it himself as soon as you remove the stress out of your life. So that's usually heals itself, stress related, less than 4 weeks. Okay, that's less than
Yep.
1%. That's less than 1%. Now the 99%, that's everybody that's listening. Okay, when I was in medical school, Chef Jay, they said when you hear hoofbeats, right? Hoofbeats, you think horse, not zebra. Well, Doc, it could be a zebra less than 1% of the time, yes. But do not
Mm.
bet the farm on the zebra when you hear the hoofbeats. So 99%, that's going to be everyone that's listening. They're going to be what's called chronic patterns, okay? Now, chronic patterns, anything over 4 weeks. Okay, great. That's everybody that's searching. So you have
Yep.
a over 4 weeks. It's happened over months. It's happened over years. Now, what they're going to notice about their pattern is they're going to say, I've got hair fall and I want to find a pattern of hair loss. And that's where you need to separate things right there, Chef Jay. Hair fall,
Yep.
hair fall is not hair loss. Boy, that's gonna get a lot of people all tied up, Chef Jay. So I'm gonna say it one more time because it is the one of the most important criteria to determine before you can move forward. Okay, so you're looking for a pattern of hair loss, and what I want you to look for is the timing. Is it short, or is it a pattern that occurred after a few months and years? That's 99%. 99% of people have a chronic pattern of hair loss. But is it hair falling out, as you mentioned? Hey, Doc, a lot of hairs are falling out. or is that causing hair loss? And once again, hair fall does not
Yep.
cause hair loss. Hair fall does not cause hair loss. So now,
So,
so hair fall,
yep.
Chef Jay, hair fall, how many is normal, right? How many is normal? This is where it gets a little bit more confusing. This is where you see Chef Jay, at some point in time, they're going to have to get off Google and find an expert, right?
Yeah.
Because now we're going to get into hair fall. Well, Doc, what's a normal amount? How can I figure that part out? Because I got them on my pillow. I've got them in my shower. I've
Yeah.
got them on my towel. How many is that,
Now,
Chef Jay? Well, we
now,
deal with,
yep. Are we talking about hairs that aren't replacing themselves?
well, that's what we're going
Is
to
that
get.
what's
See, you start to see, Chef
okay?
Jay, where you start to need experts getting involved because, first of all, we're precision medicine. And today, the last 10, 20 years, with calculators, people can, do a much better job of calculating numbers. So we're more precise today than we were 20 years ago. So how many hairs are falling out? If you're telling me it's on your towel and on your shower and on your bed, that's not a number count. Now, here's the truth.
Yep.
99% of the people that are on the Google that are searching for patterns of hair loss and hair fall do have too much hair falling out. Hair fall does not cause hair loss. Hold on, Doc. You're
Right.
getting very
Yeah.
confusing. So I've got more hair falling out, 99% of the people searching, because they do have hair loss, not because of the hair fall. All right, Doc,
Okay.
hair hair fall doesn't cause hair loss. Well, if it fell out, it shouldn't be on my head. And as you mentioned, Chef Jay, there's a normal amount of hairs that will turn over. And anagen, catagen, telogen phases of hair cycle, the hair lasts for about 7 years and then it's replaced. But God makes sure that they're replaced all over the head, so it's not, there's no pattern that develops. It's all over, right? So you have a universal hair loss. So, well, hold on, Doc. 150. First of all, that sounds like a lot. I never noticed it before. So when you start getting a chronic pattern of hair loss, it starts with a doubling and tripling of the numbers of hairs that are replaced and turned over. So you do get, instead of 150 hairs a day, you'll get 350, 400 hairs that are falling out, but they're being turned over. They're falling
Yeah.
out, but they're being turned over. So they're falling out, but they're not outside your head. They're being turned over. They're turned over to be miniaturized. So you have a lot of hairs and more hairs that are turning over and more hairs that are turning over. They're miniaturizing. They're
Yeah.
miniaturizing. Each hair cycle miniaturizing. Hair falling out, lots of them turning over, not falling out of your head, but being replaced with a thinner hair. Being replaced with a
Yeah.
thinner hair. Pattern, chronic pattern over time. Each cycle, less thick hairs, miniaturized. That becomes a pattern. Miniaturization is the pattern. Miniaturization is a pattern. It's not male. It's not female. It's
Yes.
miniaturization. Well, hold on, Doc. There's the whole head. Where is it? Where is it miniaturizing? Until Chef Jay, you understand the 5 zones on your head, how could you ever determine if you've got miniaturizations in zone 3 versus zone 2 versus zone 5 versus zone 4? Each of these zones will have its own individual growth and loss.
Yeah.
So now you start to
Right.
realize, Chef Jay, the first thing they should type into Google search is expert in hair loss, right? That's what I would type. I want to find an expert in hair loss.
So when people gradually over time, say they have hair follicles that aren't replacing themselves, and say might go from 6 to 5 to 3, from 4 to 3, that's the point where you start seeing the scalp, right? That's kind of when they're like, oh, let me type this in, let me see what's going on. There's something happening, right? So I like to think about it when I talk to people is that 80% of males and will experience some form of hair loss in their life. I mean, whether it's down the road or sooner than later, but most people will experience it, including yourself, right? I mean, so it's best to get tested and to see if you're carrying the enzymes that may be causing it. But more than not, you probably are going to have to deal with it, right?
So Chef Jay, you unpacked a lot there. So getting back to the patterns, as you mentioned, you're talking about the hair follicle losing hairs from 6, 5, 4, 3, 2, 1. Well, that type of pattern that you described would be the pattern that we can discover using a microscope, and only using a microscope. And less than 1% of the patients that come to see us actually are viewed under a microscope. So if you have the ability, the first thing someone needs to do is look at your hair under the microscope. And the person looking at your hair under the microscope needs to be a hair regrowth expert. Otherwise,
Yep.
you've just magnified a problem that no one understands. Because as you mentioned,
Right.
it's not the individual hair follicle, but it's the pattern of the hair follicles related to its neighbor within each of its zones. Well, Chef Jay, you
Yep.
just went way too far. Now we went from elementary school to high school, and now we're taking people
Yep.
to college. And we haven't even talked about the first law of thermodynamics or what the blood molecules have to do with this whole story. But you start to realize that sometimes I think we may be over talking to some of these patients that are calling in. You know, hey Tom,
Yep.
you've got hair fall, hair loss, hair something going on with your hair. Yes, okay, great. If you can get to the LA office, you get to be viewed under the microscope. That's amazing. If you cannot do that,
Yeah.
obviously the next step is blood work, right? Chef Jay, blood work would be the next step, because anything to do with hair is caused by something inside your bloodstream. Therefore, it makes logical sense to get the blood work to then
Yep.
describe how the pattern of hair loss was caused. And boy, that's a fun story. But you start to realize you would need to go to school, elementary, to high school, grade school, then up to the college, before people really understand how a molecule imbalance inside their bloodstream can cause miniaturization of hairs by decreasing the life cycle within 5 different zones. Chef Jay, you just told them you came from Mars.
Yeah. Well, and
That's
you
super.
know, the other side of the microscope is it's not always negative. You know, a lot of times you'll put people under there and say, "Hey, there are hairs under, you know, that you can't see with the eye, but with that microscope, you can see those follicles, and once they're there, you can regrow them."
Now, Chef Jay, that's what usually happens. Those patients that have really figured it out, that we know what we're doing, we can take care of them, and they fly over to Los Angeles. They look under the microscope to find out what their potential, so that we can best manage their expectations. Because if the hair follicle has died, which they will, if it has already died, do not expect it to be resurrected. But the hair follicle, once it's dead, it will not come back again. So under the microscope, we can ascertain the degree of follicles that have died versus still alive.
Another question is, if people are dealing with recession or, you know, widow's peak type of thing, is that pattern going to happen a lot faster, and are they more? Is it more of a problem to regrow? That's another big question people are asking.
Okay, Chef Jay, let's unpack that one. So recession, boy, that's a tough word to understand. So recession is caused by miniaturization. So when someone says I've got recession, that they understand that they had something and now they have less of it. So what happened?
Yeah.
Either all those hairs fell out, right? And that's what people think, Chef Jay. But if they really think, it got thin first. It got really thin first, and it got very miniaturized first before it started receding. So the hair follicle, just use your logic, right? If you're a tree that has to poke through the sand, and each time your life cycle, the sprout that pops up is less thick, and less thick. Eventually, that little bitty thin hair, Chef Jay, the last one that comes up, can't even push through the sand, which is the skin, right? So if you can't push through the sand to get to the sunlight, no, little hair follicle, you're not going to make it. You're going to recede. Now, under the microscope, we find out that those hair follicles are still alive, because they're just very small, and that can last for 10, 15. We've had people, Chef Jay, that have lost their hair for 20 years. 20 years, no hair, and almost full heads of hair are coming back. So you
Yeah.
never know when it's too late, but there will be a point in time when it will be too late.
Yeah, there's even people now collecting hairs in the shower, trying to put them up against the shower wall to see. Um,
Chef Jay, there's a company that asks you to take one of your hairs, pluck it out, or the ones that fall, put it in an envelope, send it in to us, and we're going to personalize something based on dead
yeah,
keratinized protein. Chef Jay, I can tell you exactly what's inside that hair follicle before that hair piece of hair before they send it in. The same thing that's in every
yeah,
single hair that comes in.
yeah, and that's it. I mean, if anyone's typing anything in Google about hair loss, hair, patterns, anything like that, generally there's an inclination that something is off and there's a red flag, which comes down from the unbalanced biochemistry, the what you may have been given by your parents. But if you are, you know, searching for this information, chances are most likely you already have a problem. So we could talk all day about patterns and recession and all miniaturization, but effectively just go and get the biochemical report card done, and because it's based off of something happening within the inside. It's something that could be maybe not inherited, could be just diet and lifestyle, it could be stress, it could be hormonal, right? It could be a lot of different factors. And what's the only way to know is through that blood test, right? So that's again to dispel all these myths and everything. And next week will be another one, but it's like you wouldn't take your Tesla or your BMW or whatever car it is. They plug it into a machine and they'll tell you exactly what's wrong, and you wouldn't not do that, right? And so why wouldn't you do that with your own body?
You're right, Chef Jay. So
It's
get that blood work done, and the blood work is the DNA blood work, Dr. Nettles' alopecia test. Dr.
Yeah.
Nettles' alopecia test, the DNA blood work. Yeah.
Now, when you look at that blood work versus looking at a microscope, which do you rely more on? Do you rely more on the microscope and looking at the hair, or can you tell from those numbers? Oh wow, I see the problem.
That's a very good question, Chef Jay. So my question to you would be, if you could look at someone's skin and decide what antibiotic to use versus looking at the bacteria under the light microscope, right? Once you can see the type of bacteria, it's a lot easier to decide which type of antibacteria you want to use. So with
Yeah,
the patterns of the hair loss, you're using a light microscope, and you can see things that are very small. But in the blood, Chef Jay, we're using a microscope an X-ray microscope, an X-ray picoscope, because the sizes of the molecules are picoscopic. That's 1,000
yeah,
times smaller. So I like to look at the patterns. They make us feel good, warm, and fuzzy. But the molecules, right, the thing's 1,000 times smaller. Once you know the type of bacteria, it's easier to find out which antibiotic I should use as a physician.
yeah,
So more precision. So I think as a physician, we're going to always use the most precise, accurate data. And that's why every single patient that comes in gets the outcome that we describe based on managing the expectations, because we're dealing with a mathematical problem. 2 plus
yeah.
2 will always equal 4.
And oftentimes it's not just the hair issue that gets resolved; it's other issues as well that are, part of it. The hormones, people's anxieties, people, um, sleep issues, their diets are out of whack, and you put them back on the right path. So it's much more than just the benefit of the hair on the head. So it's again, I urge people to get that biochemical report card, and for the people that want to dig deeper on the blog and on the Stop and Regrow website, we have all of these this medical journals, and you want to read about hair miniaturization, if you want to read about all this stuff we're talking about, you don't need Google. just go to the Stop and Regrow website, and you can read journals for days that we'll put up there, so people
Chef
have
Jay,
the right information.
Chef Jay, you guys have done a great job with that website. Every time I go near it, there's so much information. I think you could get lost, and that's why I think you need to have someone really guide you down here. Because as you
Yeah,
mentioned, there's so many different facets of hair loss. People still come into my office. Last week, someone's still using those laser caps. I thought
yeah,
that came around in the 1990s or early 2000s, but people are still using the laser caps. And a couple of weeks ago, someone still got that blood spinning PRP
yeah,
injected into their scalp. So people are still doing the things that their fathers, the same mistakes. It's generational. So you wait for a generation to pass,
yeah,
and you go back out with the same types of gimmicks. But today, with precision medicine, you and I, everyone can view. So under the microscope, Chef Jay, they actually see. I asked them to describe what they see under the microscope. And when the blood work comes out, I tell them if the numbers are not inside these ranges, you don't have this condition. If certain
yeah,
numbers are not within a certain equation, you don't have the. So we get to rule out a lot of stuff. So it's not necessarily always looking for bad stuff. Come on in, get the blood work. Let's rule out a molecule causing your hair loss. So if you don't know what's causing it, let's rule it out with
yeah,
the blood work. So instead of thinking about coming all in and getting treated, Chef Jay, I think first thing, get your diagnosis right. So come in, get the
yeah.
blood. Let's rule out this enzyme deficiency causing your hair. Let's rule in something else, Chef Jay.
And like you said, the people will do what their parents have done, their father have done, but there are people as well that break the cycle, like young Brandon from Australia who got on a plane and flew to Los Angeles to do what we're talking about. You don't need to do that. You can do it at a local lab near you, but there are people, young people, that say, no, I don't believe in this, and I think that this is a new way. And I like to tell people to do first get the blood test, order the blood test, then go do all the research you want, and then meet with the doctor with all that information, and that allows for a nice conversation between the patient and you, right? So um, there are a small percentage of people. That's why we're trying to get the word out to the others that what you see on GNC and Amazon and whatever the marketers are pushing. Don't believe the hype because they don't have the expertise and the years of doing what you're doing in specialized hair regrowth. So again, doctor, thank you for your time. We'll get this information out and update the website and the blog and join you next week for another trending topic here on Ingredients for a Better Life. Thank you, doctor.
Sounds great.
Have a good day. We'll talk to you
Chef
soon.
Jay, enjoy your week, my friend.
Okay, see you.